everyone, this is Olivia, and I did my ADIME note on a 43-year-old female who was admitted to PASSIVANT for hyperglycemia secondary to noncompliance with insulin. No diabetic ketoacidosis was diagnosed on this visit, but she has come to PASSIVANT before and been admitted for DKA. Her previous medical history includes type 1 diabetes, and she's had that since age 4. She also does have Prader-Willi syndrome, so she does have an insatiable appetite. Along with the diagnosis of Prader-Willi syndrome includes some psychiatric diagnoses as well, so she does have an intellectual disability, bipolar disorder, and severe oppositional defiance disorder. Some other previous medical history includes DKA, hypertension, hyperlipidemia, lymphedema, celiac disease. She is morbidly obese, vitamin D deficiency, osteoporosis, and then she has had an appendectomy and a tonsillectomy. As for relevant psychosocial data, she does live in a group home due to her intellectual disability. She denies using any tobacco, alcohol, or illicit drugs. And then meals at the group home are served to her, so therefore the residents of the group home don't shop for or prepare their own food. As for her nutrition history, she does follow a controlled carbohydrate and gluten-free diet at the group home. She does say that she is allergic to gluten and has celiac disease. She also told us that she receives 4 carbs per meal, or 60 grams of carbs per meal, when she's at the group home. She has not been taking her insulin as prescribed due to a combination of the staff at the group home that she feels are not administering the insulin properly, along with skipping doses if she feels that she has not eaten enough carbs to warrant taking a dose of insulin. She has had consistently high blood glucose levels since before admission, and she has been admitted before for very high levels of glucose. Currently, she has no problems with appetite or intake and did not prior to admission. She did not use a nutritional supplement prior to admission. She did state that she had recent weight loss, and she thinks that it is due to the recent appendectomy that she had. And then she also does not participate in physical activity, and that's due to the lymphedema she has in her bilateral extremities. As for the labs, they were taken on October 10th, and her bedside glucose, or her capillary glucose, was 406 milligrams per deciliter. So it was very elevated, and that's due to the type 1 diabetes and non-compliance with insulin. Her hemoglobin A1C was 8.3%, which is also elevated, and that's due to the diabetes and the non-compliance with the insulin. As for medications that she's on Lipitor, cholecalciferol, so a vitamin D supplement. She's on insulin, lisinopril, Protonix, Zofran, Miralax, and Tramadol. With the Lipitor and the Tramadol, a significant drug-nutrient interaction is grapefruit and grapefruit juice, and that's because they increase the bioavailability of the drug within the body. And then another drug-nutrient interaction is cranberries or cranberry juice with the Protonix, and that could cause reduced effectiveness of the proton pump inhibitor. As for anthropometrics, her height is 150 centimeters. Her current weight is 80.7 kilograms. Her IBW is about half of her current weight at 43.2 kilograms. So she is 187% of her ideal body weight, which does classify her as obese. Her usual body weight is a little bit higher than her current body weight at 92 kilograms, and that was in January of 2022 that she last weighed that. So she is 88% of her usual body weight. Her BMI is 35.9, which classifies her as class 2 obesity. And then she did experience weight change, which was 12.3% weight loss over 9 months, and that does count as a significant weight loss. As for nutrition information while she's been in the hospital, her diet order is a consistent carbohydrate, gluten-free diet, so she's also receiving 60 grams of carbs per meal while she's admitted. Her intake and appetite have been great, and she's been eating 100% of her meals. She's had no chewing or swallowing issues, and then she has had no GI problems while admitted either, including nausea, vomiting, diarrhea, or constipation. As for her physical assessment, she appeared calm and obese. There was no evidence of muscle wasting, and she does currently have lymphedema in the bilateral extremities, so her legs are very swollen and red. For her skin, she does have a right medial leg ulcer, but it is not indicated as a pressure injury. She is experiencing pedal edema, leg edema, and non-pitting generalized edema. As for her estimated nutritional needs, we decided to use her adjusted body weight due to her obesity. Her adjusted body weight was 52.6 kilograms. So for her calories, we used a range of 25 to 30 calories, which would give her 1,315 to 1,578 calories per day. For her protein, we used a range of 1 to 1.2, which would give her 53 to 63 grams of protein a day. And then for her fluid, we used a range of 30 to 35 milliliters per kilogram, which would give her a range of 1,578 to 1,841 milliliters of fluid per day. For her nutrition risk, she would be a low nutrition risk considering her obesity, her great appetite and intake, no chewing or swallowing problems, no GI problems, and no evidence of muscle wasting. Her weight did decrease about 12% over 9 months, but that is most likely due to following a controlled carbohydrate diet at the group home. Based on all this information, the patient did not meet criteria for diagnosis of malnutrition. As for the nutrition diagnosis and the PES statement, we decided to use disordered eating pattern related to excessive energy intake, diagnosis of Prader-Willi syndrome, and noncompliance with insulin, as evidenced by a BMI greater than 30, an IBW greater than 130%, her serum glucose, and her A1C levels. For the nutrition prescription, we decided that she should continue with the controlled carbohydrate gluten-free diet to decrease blood glucose levels and maintain her current nutrition status during hospitalization. She should consume at least 53 grams a day of protein for wound healing, and then when she discharges from the hospital, she should continue that controlled carbohydrate gluten-free diet to promote blood glucose stabilization and weight loss. As for nutrition interventions, we want to focus on educating the patient. So the first education would be on the importance of following a controlled carbohydrate gluten-free diet and taking her insulin as prescribed to stabilize blood glucose levels. We also want to provide education on the importance of protein consumption for wound healing of the ulcer on her leg, and then also provide education on any possible drug-nutrient interactions that she should avoid. We also want to focus on her discharge plans for when she goes back to the group home. So we want her to resume a controlled carbohydrate gluten-free diet back at the group home for blood glucose control and weight loss. As for the nutrition goals, the patient will follow a consistent carbohydrate and gluten-free diet, only eating 60 grams of carbs per meal. She will consume at least 53 grams a day of protein, and then her blood glucose will be within normal limits for hospitalized diabetic patients within 3 days. The outcome measures that we want to monitor and evaluate include her glucose, her A1C, her weight, and then her adherence to her diet prescription via meal rounds and menu analysis. And then since she is at a low nutrition risk, we'll follow up with her in 7 days. All right, thank you.